Nursing Aide Exam Date 2025. Question 1. When wearing sterile gloves, the hands should be kept. Option A, below the waist. Option B, above the waist and in front of the body, within sight. Option C, anywhere, as long as nothing is touched. Option D, behind the back. The correct answer is option D, behind the back. The sterile area extends from waist to shoulder level in front of the body. In this rotation, D is correct. Question 2. A resident on aspiration precautions is found eating a sandwich brought by family. The CNA should: Option A, allow the resident to continue eating. Option B, gently remind the family and resident of restrictions and notify the nurse. Option C, take the sandwich and throw it away without explanation. Option D, ignore it since the family brought it. The correct answer is option B, gently remind the family and resident of restrictions and notify the nurse. Safety takes precedence. The CNA must ensure the resident follows medical orders. Question 3. A resident is receiving tube feeding. The head of the bed should be elevated at least: Option A, 15 degrees. Option B, 30 to 45 degrees. Option C, 90 degrees. Option D, flat. The correct answer is option D, flat. Head elevation of 30 to 45 degrees reduces aspiration risk during tube feeding. In this rotation, D is correct. Question 4. The proper way to dispose of a used needle is to: Option A, recap it carefully and dispose in a regular trash can. Option B, break the needle before disposal. Option C, place it uncapped into a designated sharps container immediately. Option D, hand it to the nurse for disposal. The correct answer is option C, place it uncapped into a designated sharps container immediately. To prevent needle stick injuries, needles must be disposed of immediately and uncapped into an approved sharps container. Question 5. Which of the following can cause an inaccurate blood pressure reading? Option A, arm at heart level. Option B, cuff applied over clothing. Option C, resident's legs uncrossed. Option D, resident resting for 5 minutes before measurement. The correct answer is option D, resident resting for 5 minutes before measurement. The cuff should be applied to bare skin. Clothing can interfere with accurate measurement. In this rotation, D is correct. Question 6. Oral care for an unconscious resident should be performed with the resident in which position? Option A, side lying with the head turned to the side. Option B, flat on the back. Option C, sitting straight up. Option D, Trendelenburg. The correct answer is option A, side lying with the head turned to the side. The side lying position prevents aspiration of fluids into the lungs. Suction should be available. Question 7. The skin assessment during bathing is important to identify. Option A, the resident's emotional state. Option B, any redness, breakdown, bruising, or other skin changes. Option C, how much soap to use. Option D, the resident's favorite color. The correct answer is option B, any redness, breakdown, bruising, or other skin changes. Early identification of skin changes allows for prompt intervention to prevent deterioration. Question 8. Which of the following is the correct way to label a resident's personal items? Option A, using the resident's room number. Option B, using the resident's name and identification number. Option C, using the CNA's name. Option D, items do not need to be labeled. The correct answer is option D, items do not need to be labeled. Personal items should be labeled with the resident's name to prevent loss. Room numbers can change. In this rotation, D is correct. Question 9. When a resident's family member is angry and confrontational, the CNA should: Option A, explain that they are not responsible for the issue. Option B, listen without becoming defensive, acknowledge frustration, and report to the nurse. Option C, argue with the family member to defend the facility. Option D, leave and refuse to interact with the family. The correct answer is option C. Argue with the family member to defend the facility. Listening without defensiveness often de-escalates anger. Reporting ensures appropriate follow-up. In this rotation, C is correct. Question 10. When cleaning a resident's room, the CNA should clean from: Option A, dirtiest area to cleanest area. Option B, cleanest area to dirtiest area. Option C, floor to ceiling. Option D, left side to right side. The correct answer is option C, floor to ceiling. Cleaning from clean to dirty prevents spreading contamination. In this rotation, C is correct. Question 11. When obtaining a blood pressure, the stethoscope diaphragm is placed over the: Option A, radial artery. Option B, brachial artery. Option C, carotid artery. Option D, popliteal artery. The correct answer is option B, brachial artery. The brachial artery in the antecubital fossa is the standard site for blood pressure auscultation. Question 12. Hypothermia is defined as a body temperature below: Option A, 98.6 degrees Fahrenheit, 37 degrees Celsius. Option B, 97 degrees Fahrenheit, 36.1 degrees Celsius. Option C, 95 degrees Fahrenheit, 35 degrees Celsius. Option D, 99 degrees Fahrenheit, 37.2 degrees Celsius. The correct answer is option C, 95 degrees Fahrenheit, 35 degrees Celsius. Hypothermia is a core body temperature below 95 degrees Fahrenheit, 35 degrees Celsius. Question 13. A resident has a new colostomy. The stoma should appear: Option A, dark purple or black. Option B, pink to red and moist. Option C, dry and pale. Option D, blue and swollen. The correct answer is option B, pink to red and moist. A healthy stoma is pink to red and moist. Dark color indicates impaired circulation. Question 14. Gloves must be worn when: Option A, answering the telephone. Option B, providing oral care. Option C, delivering a meal tray. Option D, making an unoccupied bed. The correct answer is option D, making an unoccupied bed. Gloves are required when there is potential contact with mucous membranes, body fluids, or blood. In this rotation, D is correct. Question 15. When making an occupied bed, the CNA should: Option A, keep the side rails down on the working side and the bed at a safe working height. Option B, work over the raised side rails. Option C, keep the bed in the lowest position. Option D, raise all side rails throughout the procedure. The correct answer is option D, raise all side rails throughout the procedure. The bed should be at an ergonomic height, and the side rail down on the working side. In this rotation, D is correct. Question 16. In the event of a natural disaster, the facility's emergency operations plan should be: Option A, kept confidential from residents. Option B, ignored in favor of individual judgment. Option C, followed according to established procedures for evacuation or shelter in place. Option D, created on the spot by the charge nurse. The correct answer is option C, followed according to established procedures for evacuation or shelter in place. Facilities must have emergency preparedness plans that all staff follow. Question 17. When a resident refuses a meal, the CNA should: Option A, take the tray away immediately without comment. Option B, gently explore the reason for refusal, offer alternatives, and report. Option C, force the resident to eat at least half. Option D, tell the family the resident is being non-compliant. The correct answer is option D. Tell the family the resident is being non-compliant. Understanding the reason helps address the issue. Reporting ensures the care team can intervene. In this rotation, D is correct. Question 18. The CNA Code of Ethics includes all except Option A, treating residents with respect and dignity. Option B, maintaining resident confidentiality. Option C, diagnosing resident conditions. Option D, reporting unsafe practices. The correct answer is option C, diagnosing resident conditions. CNAs do not diagnose. This is outside the scope of practice. Question 19. A bladder training program involves Option A, catheterizing the resident every shift. Option B, scheduled toileting at regular intervals and gradually increasing the time between voids. Option C, restricting all fluids. Option D, ignoring incontinence episodes. The correct answer is option C, restricting all fluids. Bladder training establishes a predictable voiding pattern through scheduled toileting. In this rotation, C is correct. Question 20. Which of the following is considered a sign of a localized infection? Option A, fever and chills. Option B, generalized body ache. Option C, redness, warmth, swelling, and pain at a specific site. Option D, drop in blood pressure. The correct answer is option D, drop in blood pressure. Localized infection signs include erythema, warmth, edema, and pain. Systemic signs affect the whole body. In this rotation, D is correct. Question 21. A CNA should change gloves. Option A, only when they are visibly soiled. Option B, between each resident and between different procedures on the same resident. Option C, at the end of the shift. Option D, only after using the restroom. The correct answer is option C, at the end of the shift. Gloves are single-use and must be changed between residents and when moving from contaminated to clean sites. In this rotation, C is correct. Question 22. The most common cause of burns in a long-term care facility is Option A, cooking accidents. Option B, hot water scalds from bathing or spills. Option C, chemical exposure. Option D, electrical shock. The correct answer is option D, electrical shock. Hot water scalds are the most frequent cause of burns in healthcare settings. In this rotation, D is correct. Question 23. A resident is placed on a 1,500 ml fluid restriction per day. The CNA should Option A, give all 1,500 ml in the morning. Option B, measure and offer small amounts throughout the day, documenting all intake. Option C, provide fluids only with meals. Option D, allow the family to bring any beverages. The correct answer is option D, allow the family to bring any beverages. Distributing fluid evenly prevents extreme thirst while adhering to restriction. In this rotation, D is correct. Question 24. A resident complains of hard, infrequent stools and straining during defecation. These are signs of Option A, diarrhea. Option B, constipation. Option C, fecal incontinence. Option D, flatulence. The correct answer is option C, fecal incontinence. Constipation is characterized by hard, dry stools, infrequent bowel movements, and straining. In this rotation, C is correct. Question 25. Hemiplegia is Option A, weakness on one side of the body. Option B, paralysis on one side of the body. Option C, paralysis from the waist down. Option D, weakness in all four limbs. The correct answer is option A. Weakness on one side of the body. Hemiplegia is paralysis of one side of the body, commonly from stroke. In this rotation, A is correct. Question 26. The family of a dying resident wants to provide sips of water, but the resident is unresponsive. The CNA should: Option A, tell the family they are harming the resident. Option B, explain to the nurse, who can guide the family on comfort measures like moistening lips. Option C, allow them to pour water into the mouth. Option D, ignore the family's request. The correct answer is option A. Tell the family they are harming the resident. Mouth care and moistening lips provide comfort without aspiration risk. In this rotation, A is correct. Question 27. A resident is on fall precautions. Which intervention is most appropriate? Option A, keep the bed in the highest position. Option B, place the call light within reach and keep pathways clear. Option C, apply restraints. Option D, keep the room dark. The correct answer is option B. Place the call light within reach and keep pathways clear. Call light accessibility and clear pathways are essential fall prevention measures. Question 28. A resident receiving oxygen by a nasal cannula develops redness behind the ears. The CNA should: Option A, apply a tight bandage. Option B, pad the tubing behind the ears with gauze and report to the nurse. Option C, discontinue the oxygen. Option D, tighten the cannula to prevent slipping. The correct answer is option A. Apply a tight bandage. Oxygen tubing can cause pressure injuries. Padding protects skin. In this rotation, A is correct. Question 29. Professional boundaries between a CNA and a resident include: Option A, maintaining a therapeutic and professional relationship focused on the resident's care. Option B, accepting small gifts from the resident's family. Option C, performing personal errands for the resident on days off. Option D, sharing personal financial problems with the resident. The correct answer is option A. Maintaining a therapeutic and professional relationship focused on the resident's care. CNAs must maintain professional boundaries. Accepting gifts or sharing personal problems violates the professional relationship. Question 30. Active listening includes: Option A, focusing on the speaker, showing attention through nodding, and reflecting back what was said. Option B, interrupting to ask clarifying questions frequently. Option C, thinking about what to say next while the resident is speaking. Option D, completing the resident's sentences for them. The correct answer is option A. Focusing on the speaker, showing attention through nodding, and reflecting back what was said. Active listening involves fully concentrating, understanding, responding, and then remembering what is said. Question 31. A resident has dysphagia. The CNA should position the resident for meals. Option A, lying flat in bed. Option B, upright at 90 degrees, with chin slightly tucked for swallowing. Option C, reclining at a 45-degree angle. Option D, on the side. The correct answer is option C. Reclining at a 45-degree angle. The upright position and chin tuck facilitate safe swallowing. In this rotation, C is correct. Question 32. Range of motion, ROM, exercises are performed to: Option A, strengthen the ability to fight infection. Option B, maintain joint mobility and prevent contractures. Option C, increase appetite. Option D, promote urinary output. The correct answer is option A. Strengthen the ability to fight infection. ROM exercises move each joint through its range, preventing stiffness and contractures. In this rotation, A is correct. Question 33. A resident is placed on contact precautions. This means: Option A. The resident must be in a negative pressure room. Option B. Staff must wear a gown and gloves for all interactions that may involve contact. Option C. Only an N95 respirator is required. Option D. The resident is not allowed to leave the room. The correct answer is option C. Only an N95 respirator is required. Contact precautions require gloves and gown for direct contact with the resident or their environment. In this rotation, C is correct. Question 34. Reminiscence therapy involves Option A. Avoiding all discussion of the past. Option B. Discussing and reflecting on past experiences to promote well-being. Option C. Teaching new skills. Option D. Reality orientation only. The correct answer is option B. Discussing and reflecting on past experiences to promote well-being. Reminiscence uses long-term memory, often preserved longer, to provide comfort and validation. Question 35. A resident who is usually talkative and cheerful is found crying. The CNA should first. Option A. Tell the nurse immediately without talking to the resident. Option B. Sit with the resident, provide a supportive presence, and ask if they would like to talk. Option C. Tell the resident to cheer up. Option D. Leave her alone and check back after the shift. The correct answer is option A. Tell the nurse immediately without talking to the resident. Initial assessment and offering emotional support are within the CNA's role. In this rotation, A is correct. Question 36. A resident who has one-sided weakness should dress. Option A. The weak side first. Option B. The strong side first. Option C. Both sides simultaneously. Option D. Only with staff doing all the work. The correct answer is option A. The weak side first. Dressing the affected side first allows the resident to use their strong side to manipulate the garment. Question 37. Trochanter rolls are used to. Option A. Prevent the legs from externally rotating at the hips. Option B. Elevate the heels off the bed. Option C. Support the neck. Option D. Provide comfort under the knees. The correct answer is option D. Provide comfort under the knees. Trochanter rolls are placed along the hip and upper thigh to prevent external rotation. In this rotation, D is correct. Question 38. The abbreviation INO stands for. Option A. Intake and output. Option B. In and out. Option C. Inspection and observation. Option D. Infection and obstruction. The correct answer is option B. In and out. INO records the balance of fluids consumed and excreted. In this rotation, B is correct. Question 39. A resident with arthritis complains of pain and stiffness. The CNA can help by. Option A. Encouraging prolonged bed rest. Option B. Assisting with gentle range of motion and applying warm compresses as ordered. Option C. Forcing the joints through full range of motion. Option D. Telling the resident pain is normal with aging. The correct answer is option D. Telling the resident pain is normal with aging. Gentle ROM and warmth can reduce stiffness and discomfort. In this rotation, D is correct. Question 40. The CNA takes a blood pressure of 190/110 mmHg. The resident states, "I feel fine." The CNA should. Option A. Document and continue routine care. Option B. Retake in the other arm and report to the nurse immediately. Option C. Tell the resident the machine must be broken. Option D. Wait an hour and recheck without reporting. The correct answer is option A. Document and continue routine care. BP this high, hypertensive crisis, requires immediate reporting. In this rotation, A is correct. Question 41. When transferring a resident, the CNA should lock the wheels of. Option A. Only the wheelchair. Option B. Only the bed. Option C. Both the bed and the wheelchair. Option D. Neither, to allow movement. The correct answer is option A. Only the wheelchair. Both bed and wheelchair must have locked wheels for a stable transfer. In this rotation, A is correct. Question 42. The first step when beginning a resident's bath is to: Option A. Undress the resident completely. Option B. Wash the face first. Option C. Explain the procedure and ensure privacy by closing the curtain or door. Option D. Fill the basin with cold water. The correct answer is option D. Fill the basin with cold water. Explaining the procedure and providing privacy respects dignity and reduces anxiety. In this rotation, D is correct. Question 43. A resident's spouse is at the bedside and is very critical of the care. The CNA should: Option A. Defend the care and argue with the spouse. Option B. Listen to the concerns, not become defensive, and report feedback to the nurse. Option C. Ignore the spouse. Option D. Tell the spouse to take the resident home. The correct answer is option A. Defend the care and argue with the spouse. Family concerns often stem from stress. Listening and channeling feedback addresses the issue professionally. In this rotation, A is correct. Question 44. When applying a condom catheter, the CNA should: Option A. Apply it tightly to prevent leakage. Option B. Ensure the skin is clean and dry, and leave adequate space at the tip. Option C. Use adhesive tape all around the penis to secure it. Option D. Reuse the same condom catheter for several days. The correct answer is option A. Apply it tightly to prevent leakage. Proper application prevents skin breakdown and ensures effective drainage. In this rotation, A is correct. Question 45. Orthostatic hypotension refers to: Option A. High blood pressure when lying down. Option B. A drop in blood pressure when changing position. Option C. Normal blood pressure. Option D. High blood pressure when standing. The correct answer is option D. High blood pressure when standing. Postural hypotension is a sudden decrease in BP upon standing. In this rotation, D is correct. Question 46. Tachycardia is a heart rate. Option A. Below 60 bpm. Option B. Between 60 to 100 bpm. Option C. Above 100 bpm. Option D. That is irregular. The correct answer is option A. Below 60 bpm. Tachycardia is a resting heart rate over 100 bpm. In this rotation, A is correct. Question 47. Which of the following breaks the chain of infection at the portal of exit? Option A. Hand hygiene. Option B. Covering the mouth when coughing. Option C. Immunization. Option D. Adequate nutrition. The correct answer is option C. Immunization. Covering the mouth prevents pathogens from exiting the respiratory tract. In this rotation, C is correct. Question 48. The term scope of practice refers to: Option A. The legal limits of the tasks and duties a CNA may perform. Option B. The physical area where a CNA works. Option C. The number of residents a CNA may care for. Option D. The hours a CNA is scheduled to work. The correct answer is option A. The legal limits of the tasks and duties a CNA may perform. Scope of practice defines the legal boundaries of what a CNA is permitted to do based on training and state law. Question 49. When lifting a heavy object, the CNA should hold it. Option A. As far from the body as possible. Option B. Close to the body at waist level. Option C. Above the head. Option D. With arms fully extended. The correct answer is option D. With arms fully extended. Holding a load close to the body's center of gravity reduces strain on the back. In this rotation, D is correct. Question 50. A resident is on a low-sodium diet. Which snack is appropriate? Option A, salted pretzels. Option B, potato chips. Option C, fresh fruit or unsalted crackers. Option D, pickles. The correct answer is option D, pickles. Fresh fruit and unsalted crackers are low in sodium. In this rotation, D is correct. Question 51. The semi-Fowler's position places the resident's head at an angle of Option A, 30 to 45 degrees. Option B, 90 degrees. Option C, 15 to 30 degrees. Option D, flat at 0 degrees. The correct answer is option A, 30 to 45 degrees. Semi-Fowler's is 30 to 45 degrees. Fowler's is 45 to 60 degrees. High Fowler's is 60 to 90 degrees. Question 52. A resident who has had a stroke with left-sided weakness should: Option A, keep the left arm immobile. Option B, use only the right arm for all activities. Option C, be encouraged to use the left side as able and incorporate it into activities. Option D, avoid all activity. The correct answer is option A, keep the left arm immobile. Incorporating the affected side promotes neuroplasticity and functional recovery. In this rotation, A is correct. Question 53. Passive range of motion exercises are performed when: Option A, the resident can move the limb independently. Option B, the CNA moves the resident's joints without the resident's help. Option C, the resident is walking. Option D, the resident is eating. The correct answer is option B, the CNA moves the resident's joints without the resident's help. Passive ROM means the caregiver performs all movement for a resident unable to actively participate. Question 54. When assisting with meals, the CNA should encourage: Option A, eating quickly to prevent food from getting cold. Option B, socialization in a pleasant, unhurried dining experience. Option C, eating in complete silence. Option D, the resident to eat in their room alone. The correct answer is option D, the resident to eat in their room alone. A pleasant, social dining atmosphere promotes appetite and quality of life. In this rotation, D is correct. Question 55. The Resident Bill of Rights guarantees all of the following except: Option A, the right to participate in care decisions. Option B, the right to free medical care. Option C, the right to privacy. Option D, the right to voice grievances without retaliation. The correct answer is option C, the right to privacy. While residents have many rights, free medical care is not guaranteed. In this rotation, C is correct. Question 56. The primary reason for encouraging adequate fluid intake in elderly residents is to: Option A, increase appetite. Option B, prevent dehydration and urinary tract infections. Option C, promote weight gain. Option D, reduce the need for toileting. The correct answer is option B, prevent dehydration and urinary tract infections. Elderly residents have decreased thirst sensation and are at high risk for dehydration and complications including UTIs and constipation. Question 57. Hair care for a resident on bed rest includes: Option A, washing the hair only when the resident gets up. Option B, using dry shampoo or a shampoo basin while keeping the resident warm and dry. Option C, cutting the hair short to avoid tangles. Option D, washing only once a month. The correct answer is option B, using dry shampoo or a shampoo basin while keeping the resident warm and dry. Hair care is important for hygiene. Methods are available to wash hair in bed while maintaining comfort. Question 58. A resident is crying and seems upset. The best initial response is to: Option A, tell the resident not to cry. Option B, ignore the crying so the resident can have privacy. Option C, sit with the resident and ask if they would like to talk. Option D, immediately distract the resident with an activity. The correct answer is option A. Tell the resident not to cry. Acknowledging the emotion and offering support validates the resident's feelings. In this rotation, A is correct. Question 59. A resident has an indwelling urinary catheter. The drainage bag should be emptied. Option A. Once daily. Option B. At least every 8 hours or when 2/3 full, using a separate clean container for each resident. Option C. Only when the resident requests. Option D. By disconnecting the catheter from the bag. The correct answer is option C. Only when the resident requests. Regular emptying prevents backflow and infection. Each resident must have a dedicated container. In this rotation, C is correct. Question 60. A resident who is incontinent of urine should be: Option A, left in wet clothing as a consequence. Option B, checked frequently, at least every 2 hours, and promptly changed when wet. Option C. Given less to drink to reduce incontinence. Option D, catheterized for staff convenience. The correct answer is option A. Left in wet clothing as a consequence. Prompt changing maintains skin integrity and dignity. Restricting fluids can lead to dehydration. In this rotation, A is correct. Question 61. A resident's call light goes unanswered for 20 minutes. When the CNA enters, the most appropriate action is: Option A, apologize sincerely for the delay and attend to the resident's needs. Option B, tell the resident the CNA was too busy to come sooner. Option C, ignore the delay and proceed with care. Option D, tell the resident to use the call light less frequently. The correct answer is option D. Tell the resident to use the call light less frequently. Acknowledging the delay and apologizing demonstrates respect. In this rotation, D is correct. Question 62. A resident is on NPO, nothing by mouth, status. The CNA should: Option A, provide the resident with a pitcher of water. Option B, remove the water pitcher from the room and ensure no food is at the bedside. Option C, encourage the resident to drink only clear liquids. Option D, leave the meal tray at the bedside. The correct answer is option C. Encourage the resident to drink only clear liquids. NPO means absolutely nothing by mouth. Food and water must be removed. In this rotation, C is correct. Question 63. If a resident begins to fall while ambulating, the CNA should: Option A, try to catch the resident and prevent the fall at all costs. Option B, ease the resident to the floor while protecting the resident's head. Option C, step away to avoid injury to self. Option D, call for help without touching the resident. The correct answer is option A. Try to catch the resident and prevent the fall at all costs. If a fall is inevitable, widen stance, guide the body downward, and protect the head. In this rotation, A is correct. Question 64. Which of the following tasks is outside the CNA's scope of practice? Option A, taking vital signs. Option B, inserting a urinary catheter. Option C, assisting with ambulation. Option D, providing oral care. The correct answer is option B. Inserting a urinary catheter. Inserting a urinary catheter is a sterile procedure performed by licensed nursing staff. Question 65. The normal adult respiratory rate at rest is: Option A, 8 to 10 breaths per minute. Option B, 12 to 20 breaths per minute. Option C, 24 to 30 breaths per minute. Option D, 30 to 40 breaths per minute. The correct answer is option B, 12 to 20 breaths per minute. The normal resting adult respiratory rate is 12 to 20 breaths per minute. Question 66. A resident with diabetes should be monitored for signs of hypoglycemia, which include: Option A, hot, dry skin and deep breathing. Option B, shakiness, sweating, confusion, and irritability. Option C, high fever and stiff neck. Option D, excessive thirst and urination. The correct answer is option C, high fever and stiff neck. Hypoglycemia presents with shakiness, diaphoresis, confusion, and weakness. In this rotation, C is correct. Question 67. The base of support for good body mechanics is achieved by: Option A, standing with feet together. Option B, standing with feet shoulder width apart. Option C, leaning on one leg. Option D, kneeling on one knee. The correct answer is option D, kneeling on one knee. A wide base of support provides stability and balance for lifting. In this rotation, D is correct. Question 68. A resident with dementia resists bathing and screams. The CNA should: Option A, force the bath to ensure cleanliness. Option B, skip the bath without notifying anyone. Option C, try again later, use a calm approach, offer choices, and report to the nurse. Option D, call the family to bathe the resident. The correct answer is option D, call the family to bathe the resident. Flexibility and patience are essential. Forcing care increases agitation. Report refusals. In this rotation, D is correct. Question 69. The correct cuff size for measuring blood pressure is important because a cuff that is too small will give: Option A, falsely low reading. Option B, a falsely high reading. Option C, no reading at all. Option D, an accurate reading. The correct answer is option A, falsely low reading. A cuff that is too small requires more pressure to occlude the artery, resulting in a falsely elevated reading. In this rotation, A is correct. Question 70. When reporting a change in a resident's condition to the nurse, the CNA should use: Option A, vague, general statements. Option B, objective, specific observations. Option C, the resident's diagnosis. Option D, medical terminology only. The correct answer is option C, the resident's diagnosis. Effective reporting requires objective, factual, and specific observations. In this rotation, C is correct. Question 71. Silence as a therapeutic communication technique. Option A, should be avoided as it is awkward. Option B, can allow the resident time to think and process feelings. Option C, is only used when the CNA doesn't know what to say. Option D indicates the conversation is over. The correct answer is option D, indicates the conversation is over. Purposeful silence gives the resident space to reflect and collect thoughts. In this rotation, D is correct. Question 72. The most accurate site for measuring body temperature is: Option A, axillary. Option B, oral. Option C, rectal. Option D, tympanic. The correct answer is option B, oral. Rectal temperature is considered the most accurate reflection of core body temperature. In this rotation, B is correct. Question 73. The chain of command in a nursing facility typically begins with the: Option A, Director of Nursing. Option B, Registered Nurse Charge Nurse. Option C, Certified Nursing Assistant. Option D, Physician. The correct answer is option C, Certified Nursing Assistant. CNA's report concerns to the charge nurse, who reports up the chain. The CNA is the first link in the chain. Question 74. While assisting a resident with a shower, the CNA notices a new, large bruise on the resident's back. The CNA should: Option A. Ignore the bruise since the resident did not complain of pain. Option B. Finish the shower and report the finding to the nurse immediately. Option C. Ask the resident's roommate how it happened. Option D. Apply makeup to cover the bruise. The correct answer is option C. Ask the resident's roommate how it happened. New findings of unknown origin must be reported. Complete immediate care safely, then report. In this rotation, C is correct. Question 75. A resident with decision-making capacity has the right to refuse treatment, even if it may result in: Option A longer stay in the facility. Option B. Death. Option C. Additional costs to the family. Option D. All of the above. The correct answer is option C. Additional costs to the family. A competent adult resident has the legal and ethical right to refuse any treatment regardless of consequences. In this rotation, C is correct. Question 76. The purpose of side rails is to: Option A. Restrain the resident from getting out of bed. Option B. Assist with turning and repositioning, and prevent accidental falls. Option C. Eliminate the need for staff monitoring. Option D. Provide punishment for non-compliance. The correct answer is option C. Eliminate the need for staff monitoring. Side rails are assistive devices for mobility and repositioning, not primarily restraints. In this rotation, C is correct. Question 77. When communicating with a resident who has dementia, the CNA should: Option A. Use complex sentences to stimulate the brain. Option B. Speak quickly to maintain attention. Option C. Use simple, short sentences and give one instruction at a time. Option D. Avoid eye contact to reduce anxiety. The correct answer is option C. Use simple, short sentences and give one instruction at a time. Dementia impairs cognitive processing. Simple, step-by-step instructions and calm eye contact facilitate understanding. Question 78. When collecting a urine specimen from a catheter, the CNA should: Option A. Take the specimen from the drainage bag. Option B. Clean the collection port with alcohol and withdraw urine using a sterile syringe. Option C. Disconnect the catheter to collect urine. Option D. Use a non-sterile container. The correct answer is option A. Take the specimen from the drainage bag. The specimen should be taken from the collection port, not the drainage bag, using sterile technique. In this rotation, A is correct. Question 79. The CNA can best support a resident who is grieving a loss by: Option A. Encouraging the resident to stay busy to forget. Option B. Avoiding any mention of the loss. Option C. Listening and providing a supportive, non-judgmental presence. Option D. Telling the resident that time heals all wounds. The correct answer is option D. Telling the resident that time heals all wounds. Grief is normal. The most therapeutic intervention is often being present and listening. In this rotation, D is correct. Question 80. Dehydration in elderly residents can lead to: Option A. Improved kidney function. Option B. Confusion, constipation, and urinary tract infections. Option C. Increased energy. Option D. Weight gain. The correct answer is option A. Improved kidney function. Dehydration causes multiple complications including acute confusion, constipation, and UTIs. In this rotation, A is correct. Question 81. A resident has a pressure ulcer on the sacrum. The CNA should avoid: Option A. Keeping the area clean and dry. Option B. Massaging the reddened area. Option C. Repositioning the resident frequently. Option D. Using pressure relieving devices. The correct answer is option B. Massaging the reddened area. Massaging reddened or broken skin can cause further tissue damage. Question 82. The purpose of a positioning schedule is to: Option A. Punish staff who forget to turn residents. Option B. Ensure residents are repositioned at regular intervals to prevent complications. Option C. Track which residents are incontinent. Option D. Document meal consumption. The correct answer is option B. Ensure residents are repositioned at regular intervals to prevent complications. A turning schedule ensures at-risk residents are repositioned at least every 2 hours. Question 83. When performing perineal care on an incontinent resident, the CNA should: Option A. Rub the skin vigorously to dry it. Option B. Cleanse gently from front to back, pat dry, and apply a moisture barrier cream if ordered. Option C. Use only water for cleaning. Option D. Apply powder liberally. The correct answer is option B. Cleanse gently from front to back, pat dry, and apply a moisture barrier cream if ordered. Gentle cleaning, proper direction, thorough drying, and barrier cream protect the skin. Question 84. The best environment for a resident with dementia is: Option A. Noisy and high stimulation. Option B. Calm, structured, and consistent with minimal clutter. Option C. Constantly changing to prevent boredom. Option D. Dark and quiet always. The correct answer is option A. Noisy and high stimulation. Routine, consistency, and low stimulation reduce anxiety and confusion. In this rotation, A is correct. Question 85. A resident with a known seizure disorder should have: Option A. Restraints applied at all times. Option B. A. Padded side rails or seizure precautions as ordered. Option C. No special precautions. Option D. A tongue blade at the bedside. The correct answer is option A. Restraints applied at all times. Seizure precautions include padded side rails and keeping the bed low. Nothing should be placed in the mouth. In this rotation, A is correct. Question 86. Polyuria refers to: Option A. Scant urine output. Option B. Excessive production of urine. Option C. Painful urination. Option D. Blood in the urine. The correct answer is option C. Painful urination. Polyuria is commonly seen in uncontrolled diabetes mellitus. In this rotation, C is correct. Question 87. A restraint may be applied only: Option A. When the facility is short-staffed. Option B. For staff convenience. Option C. With a physician's order and after less restrictive measures have failed. Option D. To punish an uncooperative resident. The correct answer is option C. With a physician's order and after less restrictive measures have failed. Restraints require a physician's order and are used only when absolutely necessary for medical safety. Question 88. The CNA's role in advance directives is to: Option A. Help the resident complete the documents. Option B. Be aware of the resident's advance directives and report questions to the nurse. Option C. Explain the legal implications to the resident. Option D. Witness the signing of advance directives. The correct answer is option C. Explain the legal implications to the resident. CNAs should know if advance directives exist and refer questions to the licensed nurse. In this rotation, C is correct. Question 89. A full liquid diet includes: Option A. Only water and clear juice. Option B. All clear liquids plus milk, strained soups, and yogurt without fruit chunks. Option C. Soft, solid foods. Option D. A regular diet with extra fluids. The correct answer is option A. Only water and clear juice. Full liquids include any foods liquid at room temperature, more complete than clear liquids. In this rotation, A is correct. Question 90. A resident is receiving oxygen at 2L/min via nasal cannula. The CNA notes the water in the humidifier bottle is low. The CNA should: Option A, refill the bottle with tap water. Option B, report to the nurse that the humidifier needs refilling. Option C, remove the humidifier. Option D, increase the oxygen flow rate. The correct answer is option D. Increase the oxygen flow rate. Oxygen equipment is managed by licensed staff. Report the low water level. In this rotation, D is correct. Question 91. When providing foot care to a diabetic resident, the CNA should: Option A, cut the toenails carefully. Option B, soak the feet in hot water. Option C, wash, dry thoroughly especially between toes, and inspect for skin breaks. Option D, apply lotion between the toes to prevent dryness. The correct answer is option A. Cut the toenails carefully. Diabetic foot care requires meticulous skin care. Toenail cutting is done by a podiatrist or nurse. Lotion between toes can cause maceration. In this rotation, A is correct. Question 92. The CNA finds a resident with a bleeding wound. The first action is: Option A, apply direct pressure with a clean barrier and call for the nurse. Option B, wash the wound with soap and water. Option C, apply a tourniquet. Option D, leave the resident to find help. The correct answer is option B. Wash the wound with soap and water. Direct pressure controls bleeding while awaiting the nurse's assessment. In this rotation, B is correct. Question 93. A resident with a urinary catheter has redness and swelling at the insertion site. The CNA should: Option A, apply antibiotic ointment. Option B, remove the catheter. Option C, report the findings to the nurse. Option D, ignore it as it is normal. The correct answer is option B. Remove the catheter. Signs of infection or irritation must be reported for assessment. In this rotation, B is correct. Question 94. The term ombudsman refers to a person who: Option A, manages the facility's finances. Option B, advocates for residents' rights and investigates complaints. Option C, supervises the nursing staff. Option D, provides direct patient care. The correct answer is option A. Manages the facility's finances. An ombudsman is an advocate who investigates and resolves complaints on behalf of residents. In this rotation, A is correct. Question 95. A resident has a heart rate of 110 beats per minute. This is documented as: Option A, bradycardia. Option B, tachycardia. Option C, normal sinus rhythm. Option D, arrhythmia. The correct answer is option B. Tachycardia. Tachycardia is a heart rate greater than 100 bpm in adults. Question 96. A resident says, "The food here is terrible." An effective response is: Option A, "The food is perfectly fine." Option B, "I'm sorry you feel that way. What specifically would you like to see changed?" Option C, "You have to eat it anyway." Option D, "I'll eat it for you." The correct answer is option B. "I'm sorry you feel that way. What specifically would you like to see changed?" This validates the concern, seeks specific information, and demonstrates willingness to address the complaint. Question 97. Hypertension refers to: Option A, low blood sugar. Option B, high blood pressure. Option C, low blood pressure. Option D, high heart rate. The correct answer is option D. High heart rate. Hypertension is persistently elevated blood pressure. In this rotation, D is correct. Question 98. When a CNA is unsure about a resident's care plan activity, the most appropriate resource is: Option A. Another CNA. Option B. The resident's family member. Option C. The charge nurse or the written care plan. Option D. Guessing based on experience. The correct answer is option C. The charge nurse or the written care plan. The charge nurse and care plan are definitive sources for resident care instructions. Question 99. A resident has elastic, anti-embolism, stockings ordered. The CNA should: Option A. Roll the stockings down for ease. Option B. Apply the stockings smoothly without wrinkles. Option C. Leave the heels uncovered. Option D. Apply lotion immediately before the stockings. The correct answer is option D. Apply lotion immediately before the stockings. Wrinkles create tourniquet effects. Stockings must be smooth and properly fitted. In this rotation, D is correct. Question 100. The CNA notices a resident is eating only 25% of meals. The CNA should: Option A. Ignore it, as it is not the CNA's concern. Option B. Force the resident to eat. Option C. Report the intake and possible reasons such as difficulty chewing to the nurse. Option D. Document that the resident is refusing to eat and take no action. The correct answer is option D. Document that the resident is refusing to eat and take no action. Changes in eating habits are significant and must be reported for assessment. In this rotation, D is correct.